Good afternoon, everybody. It's a big pleasure for me to be here today. Thank you to the organizers for the invitation, to David for the kind invitation to be here today. I feel a bit like an outlier here because, as you mentioned, I'm not in your specific sector of activity, but I think I have something to say that might be of your interest. Eurofound, my organization, the European Foundation for the Improvement of Living and Working Conditions, is based here in Ireland, and most of our work is related to research on living and working conditions, as the title mentions. And what I want to do here today is to present some of the findings of that work that we have been doing. We all know that having a job is a good thing. It's actually good for our health. So it's more than proven through literature that not having a job can be actually very bad for your health. So this is something that is a given and everybody would agree with. But we would say, working conditions and job quality, so the jobs that people have, where they work, how they work, also matter for their health. And actually, we looked into that by using the data of one of our tools to collect data. Many of you have talked about research, but I would like to underline the European Working Conditions Survey, which is something that Eurofound has been carrying out since 1990. And every 5 years we survey workers in the European Union. So we cover all the European Union members and some other countries in Europe as well, namely the candidate countries. It's a Europe-wide survey. It's a workers' survey, so we go and knock on the doors of people throughout Europe, and we ask about their working conditions through a face-to-face interview. And usually, on average, we spend 45 minutes with that interview, and it's a very comprehensive topical coverage. We cover basic things such as working hours, but also other more complicated things related to work organization, work-life balance, etc. So what I want to focus on today is on this cover, the report that you have here, Working Conditions and Workers' Health. We looked at the relationships between working conditions and workers' health and well-being. And through that, to do that, we looked at the available models in literature, and we focused on one of the most appropriate for our purposes, which is the job demands and resources model. Maybe some of you have heard about it. And that model tells us that basically there are two main determinants of workers' health and well-being. One of those is job demands, and here we include everything from work intensity to physical risks, to emotional demands, social demands as well, working hours. All of those issues and variables are contained in there. The other element, the other side of the coin, would be the job resources. And job resources are those elements, those resources available to workers that have, in a way, a positive impact on their health and well-being and helps them to cope with their job demands. How does this work? So basically there are two mechanisms. Job demands, if they are too high, they will impact on people's health negatively through health impairment process. So basically in our model we looked at exhaustion. Some in principle we should look at burnout. That would be the mechanism to explain, but through our data we could only talk about exhaustion. So high demands, exhaustion, negative impact on health. On the other hand, resources, the higher resources you have, the more engaged you are. So this is a motivation mechanism which is at play. So the more resources that people have available at work, the more positive impact will take place regarding their health. So on your right-hand side there, you have the full model, and on the right-hand side, I was saying, you have the list of indicators that we measure in the Working Conditions Survey. It's a number of them, and it's from the number of symptoms, for example, to presenteeism, absenteeism, also sleep quality, etc., and well-being as well, which is actually measured by the World Health Organization as well. So now that we have, let's say, a good model, a good understanding of how this works, I would like to draw your attention to 4 of these determinants of health. I would like to draw your attention to the 4 most important ones. So we measure how these things interact with each other through a very sophisticated statistical model, and we found out that on the top, we find that work intensity is one of the most important factors, okay? So working at very high speed or to tight deadlines has a negative impact on people's health. Social demands, we are talking about harassment, we are talking about discrimination. This has a very strong effect on people's health. So people being exposed to these kind of situations actually are very detrimental for their health. On the other hand, in terms of resources, we see that social resources, and by social resources we refer to the support given by colleagues, the support given by managers, and also recognition for the work that you do, and justice in the organization where you work on. At the same time, also very important, the rewards. What we look at here is about fairness of payment, so to what extent people feel that they are fairly paid, but also having career prospects and having job security, knowing that you're not going to lose your job in the next 6 months. So if we want to interact, all the factors that are in the model, and you can have a look at it at a later stage, all of them are important, but these are the 4, let's say, top ones with larger effects on health. Then we looked at specific groups. We wanted to understand a little bit more who are those people who are most at risk of having poor health because of their working conditions. And one of the things we looked at was the skills levels, the occupations. What kind of occupations are more exposed to low job demands and higher job demands and lower job resources? We found out that basically that's what the data tells us. Elementary occupations or requiring lower level of skills are those most exposed. Okay, so you can think about a bunch of different occupations, but those at the bottom of the ladder in terms of skills are very much at risk of reporting poor health and well-being. We also look at sectors. And here we have the tradition, found out through our data that the usual suspects showed up. So we have people working in transports, we have people working in construction, also those working in industry report above average demands. You can think about long hours, for example, or physical demands, physical risks, but also very important, so people working in health. This is a very interesting finding. People working in health, they report above average emotional demands and social demands and below average job resources. We also look at the type of employment relationship that people have with their employers. And we find out that those reporting insecure jobs or fixed-term contracts are also more at risk. People affected by high working time demands, those working at night, those working during the weekend, those working shifts are more likely to report poor health and well-being. So high working time demands also play a role, and occupations and people working in this kind of situations are more likely, more at risk of poor health and well-being. We also look at another important thing. Recently, we have been talking about recovery in the European Union. In 2010 and before, there was a large economic crisis, and a lot was talked about in terms of restructuring. Many companies decreased the number of employees working for them, and we looked at those that survived that process, those that have been exposed to a reduction of employees at their workplace, but they continued to work there, the so-called survivors. And actually, these people are very much so at risk of poor health and well-being. Why? Because they report higher work intensity, they report higher social demands, and they report below average job resources. So also someone to take into consideration. So when we look at all these groups, we can think about situations, and in your area, in facilities management, you can see that there are some situations that you can intervene and can contribute, certainly so, to reduce this sort of risks and try to intervene. So the question here is basically, what can we do about this? So what should we do? And the most obvious reply would be reduce job demands and increase job resources, right? It sounds like a very easy thing to do, but in fact, and through the experience of research that we have been doing in our organization and others, it's not that easy. But if we have to select a place where to start, I would say let's start by the 4 top determinants that we defined, and we found out through our analysis. So let's look at work intensity. How can we reduce work intensity and plan people's work better? How can we reduce social demands? To what extent people are dealing with issues such as harassment or discrimination at work? How can we tackle that and try to reduce those effects? And then try to increase the social resources available to people. Sometimes we always think about the economic cost. How much does it cost to implement something? Support by the colleagues and support by the managers, the supervisors, costs nothing. It's just a matter of trying to get people to help each other out and work in a better environment. And also rewards. It's not just about the money, but also recognition of the work that people do and try to improve that in such a way that they are more engaged, more motivated, and that will have a positive impact on their health. What I would like to underline, and I'm almost finishing, is that we still have to bear in mind that physical risks are still present. We keep talking about automation, robotization, lots of tasks are being substituted by machines, but we still have a lot of people doing physical work. And if we think about some, for example, nurses or doctors working in hospitals, they still have to lift people from one bed to the next one. That's heavy lifting, okay? And this occurs several times. So there's still physical risk. There's still physical demands around here. And it's not just in industry or construction or other so-called heavier sectors. But also important is to keep an eye on the so-called emotional demands and social demands. And emotional demands, I still didn't mention them yet, but emotional demands have to do with dealing with difficult situations at work. For example, dealing with death or with sick people in the hospitals, in the health sector. That's a good example. Or people dealing with angry clients, or with pupils, or with patients. That's a situation that people are exposed. It's increasing according to our data, and we have to keep an eye on that. Social demands is the same thing. It's as I mentioned, being exposed to harassment and discrimination, and these things seem to be slightly increasing. So we have to keep an eye on this, particularly in sectors such as health, for example, and also education. Teachers and professors are exposed very much also to these kind of situations. So we have to keep an eye on that. To conclude, what can we do and at what level can we intervene in order to tackle these issues? So first of all, we can think about the supranational. So we can think about the European Union, the Commission, for example, coming forward with ideas. We have the example of the European Pillar of Social Rights, which entitles people to a number of issues, namely better working conditions, and that's a starting point. But then how to implement that in the ground floor? We have to think about, for example, national legislation, but also social partners, trade unions and employers' organizations can themselves get together, sit down, and come up with agreements to deal and tackle with these things. Then the workplace, several times here, the core place and the workplace has been mentioned, and that's very important, actually. That's where the change can happen, and that's where facilities management perhaps can make a difference there. Also always important is to consult employees and individuals themselves. If they know and if they are aware of these situations of the, let's say, potential negative impacts of work on their health, they can themselves alert us to those situations and intervene and help come up with better interventions. Thank you so much for your attention. I would ask you to have a look at our website, and please get in touch if you want to ask any questions. Thanks so much.
Thank you very much.